When the community was beginning to understand the state's data, DPH changes it up. In fairness, they are trying to make the numbers more transparent, but Reveal investigator Rebecca Lindstrom says that doesn't make it any less confusing.
The state made the changes earlier in the month, but it's taken a few weeks for people to notice the impact. So when a befuddled Bill emailed to ask why the CDC and Johns Hopkins were reporting numbers higher than the state, and social media lit up as epidemiologists debated just how this data should be reported, we realized one thing. You may be sick of COVID, but you are still concerned about the numbers. So let's look at the dashboard and the change that was made. You all know about PCR tests by now. Those are the standard COVID tests we've been using the past 8 months. They use a nose or throat swab, even saliva, to determine if you have the virus. These tests look at viral DNA, so they have to go to a lab and can take a day or more to process, but they are highly accurate. But let's be honest, we want answers now, and that is why the antigen or rapid test has become so popular. This test looks for a specific protein to determine if you have COVID. The good news, you generally get results in less than an hour. The bad news, they yield a lot of false negatives, and that's why the state keeps the results in a separate category. It's even started breaking out deaths by whether they were confirmed through a PCR or an antigen test. Anything using the antigen test is considered probable. Here's where the debate kicks in. Remember, antigen tests give off a lot of false negative test results. That means they say you don't have COVID when you really do. But the tests are usually right when a person tests positive, and positive cases are what we're really tracking. That's why some groups like Johns Hopkins argue the data should be put together to get a real picture of COVID's reach in our community. And that's why their number and the number on the CDC's website are higher. Now, others, like the state, argue probable is not the same as confirmed and believe the data should remain separate. All of these charts you see on DPH's website are built using PCR test results only. It all goes back to understanding the data that's being presented and why looking at a trend rather than a specific number is probably more helpful. Either way, right now, no matter how you add it up, our cases are rising.
We bring you the latest numbers and trends every day, so you know how COVID-19 is spreading in Georgia. Check out our special coronavirus section on 11alive.com for daily updates.